my name is Linda Hindle. I am one of the Deputy Chief Allied Health Professions Officers, and I run our greener NHS programme, amongst other things. So I'm really delighted to be chairing this session, which is about scale and spread and building networks. And I think throughout the day we've been hearing about the importance of collaboration and networks and taking people with us on this really important journey. So that's, I think, what this session is going to cover. So we know that clinical networks are incredibly important. They facilitate learning, their community building, and they enable us to scale and spread good practice. They also enable a rapid diffusion of ideas, and they're developed usually in a way that are resilient and lack hierarchy, which I think is, even though we've been talking about the importance of leadership, that kind of groundswell that you get from a network is equally important. So I've been really pleased to be involved in the Greener AHP movement, which is a network of clinicians from across the 14 allied health professionals, but also our professional bodies, our regulator, our academics, in order to work together to embed environmental sustainability and sustainable healthcare into our practice and into our learning, and to enable our colleagues to learn quickly from each other. I'm aware, and we've heard today, that there are many other networks across our system, not least the Sustainable Nursing and Midwifery network, and of course all of the networks that are run out of the Centre for Sustainable Healthcare, and I think there are 33 of those. So during this session, we're going to have three presentations. Firstly, from Dr. Tamsin Ellis and Dr. Mike Tomson, who are from Greener Practice, which some of you may know is the UK's primary care sustainability network, and they're going to be talking about building networks. And then following them, we will hear from Anya Gopfert, who I think you've seen her name up on the screen quite a few times already today. So Anya is a senior public health Registrar and part of UCL Partners, and she's going to be talking about Connecting for Change, which is a collaboration between NHS and academic partners. And then finally we'll be hearing from Manda Brookman and Kath Brown, who are going to talk about good contagious change, the Cornwall way. So I am going to first of all hand over to Tamsin and Mike.
Hi, I'm Mike Tomson. I'm a clinically retired GP and a director of Greener Practice.
Hi, I'm Tamsin Ellis. I'm a GP in London, also director of Greener Practice and an associate with the Centre for Sustainable Healthcare.
Greener Practice is the UK's primary care sustainability network. Why did we start? Well, GP is overworked, overstretched, focusing on resolving challenges. It's target-driven, and it's run by thousands of different independent organisations. Primary care doesn't have rich pickings. It's a pretty harsh environment. This is Sheffield, where I come from. Primary care is wicked in the technical sense. It's hard to control, many variables, and they change all the time at the same time. So it's very difficult to manage. It's a wicked environment. Greener NHS, God bless it, and others therefore don't really have the energy to focus on trying to change thousands of different organisations. Despite the size and importance of primary care, it somehow seems to be not on the list of areas to be improved, addressed or supported. So every story starts with a storm, and this storm was about 6 or 7 years ago. I was meeting up after a workshop in Sheffield, a public event around climate. The event was a washout. Nobody came. There was exceptional rain, even 7 years ago, and we started talking about what we could do to be more efficient and effective than being there but not being very effective. And we thought that what we needed to do was to work together to build a network of people in primary care working together, using our background, using our skills, and enabling us to change things from the grassroots upwards. RTE led the development. I managed to find an excuse to work in Jordan and Palestine for most of the following year, and so only rejoined the network a year later. And since then, the network's changed. Some people have joined, some people have left, but overall we've been gradually building up and getting more and more experience. How did we start? Well, we started with small groups meeting, supporting each other, thinking together, using a thinking environment to think more effectively. Our initial focus was on enabling the College of GPs to declare a climate emergency. That was a success. And then realising that we were best as a distributed network across our different cities. From there we went on to developing different focus groups, just special interest groups, dealing with different areas, and Tamsin will tell you more about those. More recently, we've worked with enabling the College of GPs to have faculty representation, an elected committee, a core group working on sustainability within the college, to work alongside a nationally distributed network that we've been part of.
So who are we now from that first group in Sheffield and a few people joining to the massive network that we've created? Well, we are at our heart a network, which means we're a people-led, people-focused organisation, and that's mainly in primary care, but we do have some people from secondary care, from voluntary sector joining as well. And as part of that, we have national special interest groups, so you can hopefully read them up there, but things like education, working in QI, and it's been a really great thing, particularly for if you've got a question, you go to those special interest groups, and they often have the answer, and it's kind of sharing that information. We try and take all of that and put those resources open and free on our website, which is just greenerpractice.co.uk, and we keep building and adding to that all the time. When we became a community interest company, part of the reason for that was so that we could work in partnership with organisations, and that's happened in numerous ways, but it's been a really good, we've had a lot about collaboration today, and that's been a really good approach for how we've grown. And we continue to innovate and think about what the space needs. We heard about GPs are often overlooked, and so part of that innovation is listening and having conversations on the ground and listening to what GPs need and what people need in primary care to make effective change. So in terms of what we're doing in general practice, we're looking at the overlap of what patients want, what the planet needs, and providing high quality care. We often hear this criticism of people saying that environmental changes might cost other sort of sectors of the health sector. And what we need to think about is bringing this all together. I think Francis said it well earlier in terms of bringing this as part of a domain of quality. So part of our success has been the high quality low carbon asthma toolkit. That's been a really good place to bring together that information and share it. It's an off the shelf QI toolkit. It's got texts and videos and posters, and it's all available for people to use. There's also a poster up about it as well. So that collaboration that I mentioned, we've done that with Health Education England, with the RCGP, and made lots of learning modules and different ways of working, and we also worked on a green plan in South East London. So essentially the message is, if you're here today and you're interested in primary care or you think there's overlap, please come and join us. We've had such a great time doing this. It was meant to be a celebration when we thought about this idea, because we've had a great time, and there's people here today who've been part of it. We've got scholarships, we've had away days, we've been part of lots of different parts of campaigning, and we continue to be a small group of thoughtful, committed citizens hoping to make a difference. So if you'd like to get in touch or join up, that's our email address, and please come and find us at the end. We're also going for drinks afterwards. Anyone wants to join. Thank you.
That's the wrong set of slides. Do you want to go next?
We're not Anya.
We're not anybody at the moment.
Have we started? We started.
No, we haven't.
No, we haven't. Yes, we have.
Hi, I'm Kath Brown. I'm a GP in Cornwall, and this is Amanda Brookman.
Sorry, I'm Amanda, also still not Anya. I'm Amanda Brookman, also from Cornwall.
So we like to do things a little bit differently in Cornwall, and the first time I met Amanda, she was hosting a health and climate lab in the middle of the pandemic, and she persuaded the health leaders to declare a climate emergency and to set a net zero target of 2030.
That absolutely wasn't entirely my fault.
Much. Anyway, I soon learnt from Amanda that there was no such thing as no, and it's definitely about making the impossible possible. And it was actually a really good idea to do it in the middle of the pandemic, because we were used to taking difficult decisions, rolling our sleeves up and trying to work out how we could get to the solution. So we formed a network, and this was essentially 15 PCN Green Champions. We found a tiny little bit of money, and I persuaded Amanda to join us, along with two, as our project manager, and as well as 2 project officers. And I asked them to go and find out why the clinical model was broken, what was going on in practices, and they literally walked into 57 GP surgeries across the whole of Cornwall. It's quite a long, wide place to go. And what they found was not surprising. They found out that people were overworked, the workload was impossible, they were burnt out and stressed. But despite all that, there were little pockets of green brilliance that was going on. And people were really keen to start to reconnect with health, to connect our food and our environment with how we maintain health for our patients, and to move away from the sickness model to really being the centre of health in our communities. We wanted to collaborate. We'd already done that during the pandemic. We'd worked brilliantly with the third sector in primary care, so we made collaborations with the third sector. We blurred the boundaries. We didn't care who you were and where you came from. We wanted you to help us on our journey.
And these are some of our microgreens where we talk about tiny, tiny case studies that are one PowerPoint slide long so that it can become very, very contagious. And we've now got dozens and dozens of these. And during this work, we discovered, as well as the clinical truths, we discovered some social truths. That if you want to deliver really transformational change, you've got to deal with the fact that you're dealing with the contrary hot mess of the human psyche, much as we love it all. And we don't act logically. Those 3 social truths are, we're much weirder than we think. We're not rational. We work off habit, of social norms, of fear. Those of you who know what the amygdala is, it's the amygdala versus the hippocampus, and we really need the hippocampus to go large and start imagining better. We are the key to change. We've heard today of all these fantastic things that have happened on the ground with people just deciding to make things better because they know it's necessary. And that is really, really important, at least as important as any tech solutions. Tech solutions are way down the line in terms of what we need to do and how we can do it. And thirdly, we know people want to change, from what Kath has just said. People do want to find a way forward. They just don't necessarily know how to work within a system where we're asking them to do the right things inside the wrong system. So it's about creating examples, growing a network, assuming the permission to act, and welcoming positive deviance, which we have heard in spades today, because that's what creates the conditions. This is a good thing, by the way. Creates conditions for contagious change. The IPCC and the CCC have said that changes to our lifestyles and behaviour can result in a 40 to 70% reduction in greenhouse emissions by 2050. This offers significant untapped potential. It's on us, guys. So, very quickly, our tools are sticky. They're very, very social. We've got the microgreens, tiny, tiny case studies where we're disseminating them far and wide, and people can see who's doing what and why. We've got very simple 15 ways to get cracking on our brand new website. We had a Trello board, but the Trello board got really, really big. So now we've got a website where you can see what the 15 areas are. We've got templates working with a community artist on how you can talk about what you're doing, because we've heard again today, do it and then talk about it to your patients, to your staff, to your colleagues, to your community. We haven't heard much about the community today. It's super, super important. Froome knows that. We've got a green rocket fuel. We've got online learning sessions. We talk to the people that are delivering these things inside practices and then ask them what they're doing so we can then record that and make that available to other people. We have a greener practice network and we have people who are proud to be part of it. And we've got the Trello. But this is about contagious examples, online learning, templates and checklists, real people to help where we go out and work inside the practices with really, really, really busy clinicians and practice managers and everybody else. So we've got 15 action areas, 25 Green Genius projects. I'll speak about that in a second. 30 plus green rocket fuels, 35 pioneer practices, 40 plus microgreens. Bringing in, look, we're a team on the ground. We can bring in more money. It keeps changing, about 56 practice strong ICS and 300 plus members of that network doing all sorts of stuff. Over to you, Cam.
So our team are on the ground, as you've heard, and they're literally joining the dots for clinicians and patients. So we're joining the dots between, Amanda's going to do a little bit of role play for us, between air quality and active travel. Between energy use and health inequalities, between heat waves and health, between good food and the community, between reusing and waste. And we're starting to see the results. We're getting such positive feedback from patients, clinicians, and from staff. It's made a difference in terms of carbon footprint, it's made a difference in terms of finance, and it's made a difference in terms of staff well-being. We are essentially the party that everybody wants to be at in our network.
Hi everyone, I don't have any props, so sorry to be a disappointment. My name's Anya. I'm here on behalf of UCL Partners to talk to you about a project that we did, we started earlier this year called Connecting for Change, and I did this in partnership with the whole team, including Fiona Adshead, who is just here at the front. So UCL Partners, for anybody who's not heard of it, is a health innovation partnership covering kind of northeast central London and Essex. And we started towards kind of mid of last year, set up a climate collaborative. So to kind of figure out what the role is for a health innovation partnership to help the NHS achieve net zero and catalyse action towards the net zero target that it set itself. So we set up a project called Connecting for Change. The idea behind this was to think about how we can do things differently. So we've heard from people today about the need to work with different groups of people and bring people together. We've heard about the kind of challenges, particularly around clinical staff having the time to work on these kind of projects. And we've also heard about kind of some of the need for kind of new, weird ideas, different ways to approach things. So we tried to bring some of this together and also bring in the kind of academic role and thinking about what research is needed to also help us achieve net zero. Some of the challenges that we were trying to address, we were trying to help speed up the progress towards net zero NHS, but also tackle some of the evidence gaps that we believe exist across the system in terms of areas around net zero we don't actually know what to do. And bringing academics and NHS staff closer together so that they could work together to tackle some of these challenges. I actually came to a conference here in November last year in the BMA House where I heard first about this concept, which is a sandpit. So we took a sandpit concept and then adapted it slightly. So the basic idea is to bring together academics and stakeholders, so in our case NHS staff from clinicians and estate staff, to talk about the challenges that they're facing and the questions that need answering and come up with projects together. We did a kind of adapted, abridged model of this over a period of 2 months. So usually these things are over a period of 9 months, so we did squeeze it all in. And we decided to focus on the area of NHS estates, so reducing the carbon footprint associated with NHS estates, because this was an area which both met the criteria of the ability to have a significant impact on reducing carbon, some good research questions around which needed addressing, and we had a good group of people who were interested in working on that we knew of, so we thought it would be a good topic area to test the model. We did run this model. We brought people together for 3 events. So people applied to be part of this, but not competitively. So we sent out the invitation. People sent us an expression, you know, I'd like to participate, both to universities and hospital trusts in our geography. And we brought together 20 to 30 people over the period of time, about 50-50 split of NHS staff and academics. And we took them through a process, first of all, of defining the problem that they wanted to address. Then we brought the NHS staff, kind of articulated specific challenges that they were facing, and then worked with the academics in the room to come up with project proposals. And then we invited them to submit those project proposals to a competitive process, and we funded 4 projects as a result of that. So those projects are still ongoing, and I'm not going to talk today about the outputs of those, but that will be available at some point in the future. I want to talk very briefly about some of the learning from this process. There was absolute positive feedback from everybody that was involved. People really enjoyed having this opportunity. The academics really relished the opportunity to talk directly to people working on the ground in the areas that they wanted to kind of make an impact on and to really be able to refine their questions based on that. But the clinical staff really valued the opportunity to interact with people as well, and particularly the opportunity to have time to think about the challenges that they were facing and time to think about what it was that they actually wanted to, or what was the question that was actually going to help them move forwards. UCL Partners' role within this was to play the kind of convening, bringing the people together, creating the space and the process for this to happen. And I think that was crucial as well to the success of the project. And then we really designed the process to try and build on the incentives and motivations of the different participants. So clinical staff, as you've heard multiple times today, are really interested in working on this, or at least a large number of people are, but they're very time poor. So we tried to create an environment where they were able to participate, but without having to do the research projects themselves. Academics, not necessarily time poor, depending on where they are, I'm not saying they've got loads of time, but they would like to access funding for research projects, and they really valued having the direct clinical input of the people there. So we brought people together and built on these motivations. But we also really focused on giving people the opportunity to articulate their own experience and expertise, and then bringing the kind of environmental carbon elements into the discussion. So I just want to, that's kind of the highlight of our project. UCL Partners are going to continue working in this space. So there's going to be outputs of the 4 projects and more on the horizon. Elaine and Claudia are sat here in the middle. They're leading this work forward, so if you've got any questions, please do speak to them. And in terms of things that you can do, I think keep an eye out for these projects, because there's going to be opportunities in other health innovation partnerships across the country as well. So thank you very much for listening, and I'll hand back to Linda.
Well, thank you to all our fantastic panellists. There were some brilliant sessions, and Amanda, I think you have to win the prize for the most props in the least amount of time. So thank you very much for that. We've got about 7 minutes for questions, if anyone has any questions that you would like to raise. And I can see there's quite a lot of hands. So there's one, first one that was kind of about halfway down on the right-hand side, Candice. Did you get that? So
I think so. We definitely acted without permission, and we encouraged everybody else to do the same. I think I haven't got my glasses on, so I can't actually hear you very well. I'm just going to get my glasses. You know, if you got glasses, you know you need to see people's faces so you can hear them as well. There you go. And I think we're not clinicians. Me and my small team, and I think there is definitely a hierarchical sense of needing to have permission before you can do something, otherwise it can get you into trouble, and I think that can stop innovation. So we were encouraging people to think very, very differently and sideways, definitely ask forgiveness or permission, and assume that they can, and then find other people who think actually they're probably right. So that could be using a very small area of the outside space that's never been used before in a GP surgery as an incredible edible garden. People didn't think they were allowed to unless they could. Assuming that you could actually build something outside where you could store a bike. Assuming that you could actually start working in collaboration with third sector organisations to do something they want to do that might key in beautifully into the blue and green social prescription angle. Have conversations that you didn't think you could. Bring in people from the third sector into the waiting room to talk about what you could do differently. So I think, yeah, there's definitely a sense of probably can't, and our take is you probably can and should, and we'll help you, and we'll take the flak. We haven't done anything illegal. We've just sort of rattled the cage a little bit.
Yeah, I think the other point is that actually sometimes you just make yourself indispensable. Nobody else was doing this and it needed to be done, so we just rolled up our sleeves and got on with it, and then they basically had no choice but to fund us. So, and we deliberately didn't get funded, we didn't get employed directly by the ICB. We are funded by them but not employed directly by them, so we allow ourselves to be a little bit naughty.
I was just going to add that I think in retrospect, one of the best things is that we didn't really have a plan with Greener Practice. We weren't aiming to get 34 groups. We weren't aiming to do things. We were following the energy, and that's partly because we're a volunteer-led organisation. So we were going with what people had capacity and energy to do. And then I think we've also had regular reassessments of what's working and not working. So I don't know whether you have funding in what you're doing, but sometimes it can be a bit stifling to innovation because you have to hit targets. We didn't have any targets that we needed to hit. We just went with where that was, and I think Cornwall also went with some of the energy that was there to kind of build on what you've got rather than having this sort of big plan, which we're now working on a bit more.
Really great responses. Thank you for that. So I know there are another couple of questions. The lady in the white, and then we'll just take that afterwards, the gentleman in the burgundy jumper, and I think that'll be then the last of the questions.
Great presentations, thank you. My question is particularly about the UCL Partners Project. I really like the approach of bringing together people who know about a problem and people who might be able to figure out a solution. But let's assume there isn't a sudden massive influx of money to roll this out across the board. What can we take from this project and apply it in our sort of everyday work, and how can we use the learning from this project to apply in anything we might plan in the future? Thank you.
Yeah, thanks. So I think the really important parts here is that basically people working in the NHS, if you've got an idea for a research project, reach out to an academic who works in either in your area or in that field. And there is an increasing amount of research funding available for projects on net zero healthcare and sustainability. So there are currently about 5 or 6 opportunities that I'm aware of. So if you've got an idea, reach out to somebody either to do it with them or to be kind of an advisory person that an academic can lead the project if you don't have time to do it. So that would be the kind of number one thing. The second thing would be, I think the real thing that really struck me about this project was the people just really valued the time that they had to come together, and that's probably because our clinical roles are so busy that there's just no time to even stop and think about what's really the next step that you need to take for achieving the goal that you set yourself. So I think the other thing would be, even if you can create an hour of lunchtime where you bring together a couple of people to really talk through a project that's hit a stalling point on sustainability, or to think about what the most important thing is that you could all work on together, I think creating that time for the conversations in a smaller version than what we did is something that people could do across the system as well.
Thank you for that. And rather than going to the rest of the panel just because of time, I'm just going to move to the final question, if that's all right.
Hi, my name's Johnny Groom. I'm an anaesthetic consultant working here in London, and I've sat in the sandpit thanks to Anya on this research.
So Johnny has some of the funding, so I didn't know he was here.
So I'm not a plant. But no, I just want to say you've discussed the fact that time was given to us to come and attend these fantastic 3 sessions. But I have to say, having now undertaken the work and been working alongside researchers, where I've found the time has really been given to us is in the actual work of research itself. Now, a lot of us that are really interested in sustainable healthcare and net zero don't necessarily have those academic skills in order to write research applications and grant applications. And I was at an ICB event recently where we were given a week. We have all of these SBRI funding opportunities to come up. Can someone quickly get a thing together to write? And it's really unachievable, especially with our time constraints and with our ability. So I guess my question is there any plan to roll this out nationally? And how can we signpost people to this? Because this really is a huge accelerator into attracting funding and getting these things done.
Thanks, Johnny, and sorry for not giving you a nod. So there is definitely more things in the pipeline to do similar pieces of work across the system, and I think we at UCL Partners would be more than happy to share our expertise and kind of running this with anybody who's thinking of doing something similar, or would like to kind of think about doing something similar and think about where they can get funding. But there is more in the pipeline, both at UCL Partners but also nationally as well in other kind of health innovation networks. So stay tuned. I haven't got any details yet, but more in the pipeline.
Thank you very much, and I'll draw this session to a close now by thanking our panel members again, so Mike, Tamsin, Anya, Kath and Manda, who've given us, I think, a brilliant session on the value of and energy really of networks. So while our colleagues are leaving the stage, we've not got a proper break now. We're going to move straight into the final session. So I am going to invite Richard Smith, who is the chair of UK Hack, to come up so that he can introduce our final session with our two keynote speakers. So thank you very much.